Mumps. Yeah, mumps. I think this one maybe some of you heard about it, or maybe some students got of. So what means mumps? Yeah, what means mumps? Chinese name 炸腮. 炸 is kind of swollen. 腮 is on the side of the face area. So that means some swollen on the face area. So then we're talking about what means mumps. It is still epidemic kind of illness, means can transforming from one person to another person pretty easily, and especially go to the grass on the face. It's an acute infection kind of illness, and it caused by virus infection. Generally symptoms, fever, and swollen, and even may be painful on one side mainly, but truly sometimes can go to both sides of the face and the lower cheek area. So that's generally, generally. And it is acute respiratory system infections kind of illness. It's mainly finding in children over 3 years old and 10 ages. So that kind of age is pretty easily got mumps. This virus infection. Generally say it infections mainly on the glands on the side of the face, swollen one side of the face is bigger there. Occasionally infected with both sides, and occasionally infections to other part of the body. So for TCM etiology, that's still seasonally kind of passenger evading. So for the channels, blocking the channels, that's mainly is a food shao yang gallbladder channel. And the food 厥阴 kind of channel relationship. One is yin yang channel there. And it belongs to warm heat kind of toxins. So epidemic kind of toxins. So that's basically attacking place the mumps. That's the glands located on side of the face area and generating male heat toxins in the local area, blocking the channels, and then cause swollen glands in there. So that's the mainly for TCM. So diagnosis for this illness. Basically, if patient have exposure to some patient, they have mumps like 2 weeks before or 3 weeks before, and then go to swollen grass in there, and maybe with some other symptoms like EPI waiting, like EPI wind, fever, chilled, headache, poor appetite, then especially swollen of pituitary glands. Thus, basically, will be get diagnosis. So this illness is not truly got laboratory test. If especially grass maybe on one side is bigger, and maybe got another side is bigger swollen too after a couple days. So that's basically can got diagnosis already. Truly for Western medicine, sometimes they go to test, laboratory test for antibody, antigen levels, blood test, but not necessary, not necessary. So TCM pattern, TCM pattern. When people got this sick or illness, we talking about the passengers evading Shaoyang channel. So Shaoyang channel, sometimes we talk about half internal, half external, but here we mainly talking about the channel things. Still belong to EPI. Fever and aversion to cold same time. Still belong to EPI. And especially swollen and painful on one side mainly, possible both sides of the pituitary glands. And the affected people like eating or even speech, they need moving there, cause more painful. And maybe patient also have headache and red out and the middle jaw weaker cause poor appetite, especially for children. Children getting sick, they don't want to eat anymore. Tongue is red with thin white coating, that means normal, or maybe thin yellow coating. That's key. Pulse is superficial, means external passenger, and rapid is a heat passenger. So treatment plan for this pattern, we still dispersing wind, clear heat, and reducing swollen, and remove muscles there. So that's swollen kind of muscles coming from pituitary glands in there. And the acupuncture treatment, acupuncture treatment. Generally say we use lot of points locally, but not too local. Not too local. The swollen part mainly in front of the ear. So we are not directly use front ear points there. We use the points behind the ear. 3/17, but the channel go to them. And the stomach 6 still close there. And the LFO are distal points, and also can use for pattern points, combination with lung 7 together, and gallbladder 20 wind points. So we put some points here, but truly, if patient, the symptoms is not that severe, truly not necessary to treat. Yeah, these are still not necessary to treat, like a chicken pox. Just like a patient got good rest, they will be recover pretty soon. Yeah, it's a much uh, shorter time compared with chicken pox. So I got this sick mumps when I was 10 ages. When I was in middle school. I don't know uh, how I got it. I didn't heard about other students in my class have same the problems, but I just feel I'm sick. And then my salivary glands is getting bigger, one side, and painful. So I just stay home. I didn't remember I got a special treatment. I think I just stay home and get some rest and not truly rest. I reading some book and just stay home, drink some water. And after maybe just a week, less than a week, I recover. But I stay home about a week. So that's truly for this pattern, like the symptoms not that severe, just generally common cold symptoms plus swollen glands in there. So basically get more rest, get easy digestion food, and pretty easily recover. So that's basically for this pattern. But truly, if symptoms severe, we can thinking about some treatment like acupuncture or maybe acupuncture. So that's for this pattern. Then we're talking about the pattern heat toxin accumulation. Heat toxin accumulations is a little bit more severe compared with the first pattern. So this pattern basically is high fever and more painful and more swollen, and if touching is hard there, maybe on one side, maybe on both sides. Still most patient on one side. And we're talking about swollen there, touching getting worse there. So that's excessive pattern. So this kind of condition, patient even difficult to open the mouth. That means difficult to eating and difficult to speech and jaw. And more heat inside, patient more restless and can headache, sore throat, and thirsty, like to drink cold water. So that's more severe heat go to more deeper of the body. Still poor appetite and maybe vomiting. That means maybe combination, heat combination with some phlegm. And certainly locally, like a pituitary gland is swollen and painful, and also can infect another grass and multiple grass that's still possible, swollen, and painful. Other heat signs, patient possible constipation, and decreased amount dark yellow urinations, that's still internal heat symptoms. The tongue is red with yellow coating, that's still internal heat symptoms. And the pulse is sleepy pulse and rapid. Rapid pulse is the heat. Sleepy pulse is the dumbness. So that's a pretty combination with some dumbness. So we didn't talk about the finger wind here because this kind of illness is pretty common with 3 years old to 10 ages, like 15, 16. We talking about we looking for index finger wind. Usually it's under 3 years old. So that's we are not especially put the finger wind in here. So treatment principle, truly we need clear heat. Severe kind of heat, that's the toxin. And the grass swollen there cause the harness. We need a softer harness and remove or dispersing the muscles. Still talking about the grass swollen there. So this one truly we can use acupuncture help. So that's basically it's kind of severe kind of condition. So around here, behind the ear, and on the stomach channel, close to the swollen glands there, stomach 6. And also I4, common points of the face, also can relieve some external passengers. And the Sanjiao 5 relieve external passengers. That's kind of more severe excessive heat in there. And especially Sanjiao channel go to there. We can use the Jinliao points of the Sanjiao channel, clear heat. We also can bleeding it. Yeah, also can bleeding it. Like a Sanjiao channel, right? Go to that area around. We say Sanjiao channel is around the ear. Yeah, it's around the ear. So truly we can use Sanjiao channel mainly. And certainly we can go use some gallbladder channel. Gallbladder channel still around the ear. Like gallbladder 43. Clear some heat. So that's excessive heat in there. We need a stronger reducing technique and treat every day. So or we can bleeding the point. So that's for this pattern. So actually these illness, we may have more patterns. Like we talking about sometimes go to brain infections, sometimes go to kidney infections. That's more severe pattern of this illness. It's not that common and also not a severe kind of pattern. Always go to hospital. So I'm not putting here. I put in here just the common part. Yeah, I put in here just the common part. The first part is generally pretty like a simple pattern there. It's not that severe. Second pattern, little bit more heat toxin go to little deeper part of the body, but still not evading the organs. So I didn't put a truly affected organ pattern here because clinically we are not able to meeting that pattern. So we just got some basic idea this illness. Certainly, if the patient have more symptoms than we list here, like a severe kind of headache, and couldn't stop vomiting, nausea, that may be caused meningitis, and maybe caused like blood in the urine, and the lower back severe kind of painful in there. That may be caused kidney infection. So in that kind of case, must be go to hospitalized. So that's for this illness. Then we talking about prevention. So prevention, we know that's still contaminated kind of illness. So if some children look like during the like epidemic kind of time, and especially the children body generally kind of weaker, still try to go to public place. And even like even generally children during special seasonal Mumps epidemic time, still try not to go to public place. So that's the best preventing way. Best preventing way is still transmitted by the respirations, like a drip line. So public place, lot of people go to there. They carry different kind of virus or maybe bacterial. So even not infection for this virus, maybe got on some others illness. So for the children, especially children is weaker kind of constitution kind of children, try not to go to public uh, place. And also right now, we have pretty effective kind of vaccine. That's pretty preventing the illness. So basically, that's a vaccine. It's a combination different virus infection kind of illness together and preventing. Measles we talked about last time, and mumps, and rubella we talked about last time. So basically, we can got this kind of vaccine together. That's truly can preventing this illness. So that's why we don't have too many people or children got these infections anymore. But like before, pretty popular, yeah. Like the chicken pox, pretty popular. And so basically, if children didn't have the mumps before and didn't got vaccine before, and then like for the epidemic season coming, lot of other children got the mumps infections. So during that time, we can give the patient especially antibody. So antibody is directly against the virus, but it belongs to positive kind of immunity. It stays for a short time. It's not kept that longer time. So antibody coming from other people's is not truly working so long. So still the best way vaccine. That's basically we use antigen. It belongs to antigen. Antigen go to inside the body, trigger immunity systems, producing antibody. These kind of antibody, they have remember function. So they remember what kind of passenger go in. Second time, the same passenger go in, they will pretty faster producing big amount antibody and against the pathogen. So that's generally say we talk about vaccine, active kind of immunity. But if we give patient antibody directly, that antibody coming from other people. It's just keep short time. They are not trigger like a patient's body producing more antibody. But for emergency kind of situations, truly we can use because vaccine and trigger immunity systems producing antibody truly take some time. Yeah, truly take some. Usually after 2 weeks, yeah, 2 to 3 or even to 4 weeks, then can produce the antibody. So that's right now some people say got vaccine for COVID-19, but still got sick or illness. So sometimes their body didn't produce the antibody yet. So that's about preventing. Then we talk about nurse care. So nursing care, we're still talking about the children with the mumps separate with others in case transmission the same illness to others. Generally say, the local area swollen disappeared and no painful in there. After 3 days, can play with other children. So not like immediately like swollen disappeared. So that's why I stay at home about a week. So basically, my symptoms go away about a couple days. Yeah, it's not that severe, but I still stay home for a week, just preventing infecting with other people and keep everything clear and sterilized or disinfection for everything, clothes or maybe toys, everything children can touching. Still, in case infected with other people or transmit to the other people. And children keep in the bed until the fever relieves. So basically, acute stage is over. Yeah. Then can do some like a little bit movement. Otherwise, more rest. Yeah, more rest. Sometimes a little bit hard to tell the children just stay in the bed. They stay in the bed, they truly sick. They getting a little bit better. They try to play outside. So that's for children. And also we need looking for the children. Condition changing. If the symptoms getting better and better, that should be like the problems, illness getting better and better. But if the symptoms not relieved and getting worse and worse, even more symptoms coming, that may be some complications. So that complication kind of condition maybe need emergency kind of treatment. So that's just be careful. We say this illness mostly is not cause severe kind of situation, but truly for some children it's possible. So we keep watching. If getting better and better, that should be fine. But if the more symptoms coming and getting worse and worse, that need to go to special treatment.